This episode is sponsored by Dr. Chrono by EverHealth, the #1 mobile all-in-one EHR. Built specifically for medical practices, Dr. Chrono includes an integrated feature that powers a seamless payments acceptance experience. Dr. Chrono Payments offers multiple ways for patients to pay as well as insurance credit card processing. As a Dr. Chrono customer, you can easily activate our fully integrated payment solution that will streamline your cash flow and help you get paid anytime from anywhere. Deliver the best patient experience with a fast and easy way to collect payments. Visit drchrono.com/payments. That's drchrono.com/payments to learn more about Dr. Chrono today. Direct primary care is an innovative, alternative path to insurance-driven healthcare. Typically, a patient pays their doctor a low monthly membership and, in return, builds a lasting relationship with their doctor and has their doctor available at their fingertips. Welcome to the My DPC Story podcast, where each week you will hear the ever-so-relatable stories shared by physicians who have chosen to practice medicine in their individual communities through the direct primary care model. I'm your host, Marielle Conception, family physician, DPC owner, and former fee-for-service doctor. I hope you enjoy today's episode and come away feeling inspired about the future of patient care, direct primary care.
Direct pediatric care allows me to provide people with the care they deserve and also allows me to practice medicine in a way that feels good and aligns with my values and the reason I went into medicine in the first place. I am Dr. Cindy Rubin of In Touch Pediatrics and Lactation, and this is my DPC story.
Dr. Cindy Rubin earned her BA in psychology from Stanford University in 1994. Not sure what she wanted to do when she quote-unquote grew up, she took time after graduation to live life, which included a volunteer program in Israel. After her time in Israel, she had the confidence she needed to pursue a career in medicine. She completed her pre-med courses at Northwestern University and then earned her medical education at Georgetown University Medical School. She attended her pediatric residency at the University of Chicago Corner Children's Hospital and then worked as a hospitalist at community hospitals in the Chicagoland area. Ultimately, she was not satisfied by caring for patients in the short term as a hospitalist. She yearned for the long-term, deeper relationships that one makes as a primary care physician, and that drew her to outpatient general pediatrics. She spent 13 amazing years working for Loyola University Medical Center as an outpatient pediatrician, where she taught residents and expanded her own knowledge. She developed a particular interest in breastfeeding, earning her certification as a lactation consultant in 2019, and then pursued additional training to create a niche as a breastfeeding medicine specialist. In 2021, she made the tough decision to leave Loyola and took a leap in order to practice medicine in a way that felt more true to her own goals and was a better fit to her style as a physician. She ventured out of the insurance-based medical system and opened In Touch Pediatrics and Lactation in order to provide pediatric and lactation care in a personalized, compassionate, and patient-centered way. For her, DPC is the model that allows her to spend more time with her patients, something sorely lacking in the traditional system of medicine. This not only provides her patients now with better care, but also provides her with a more fulfilling experience as a doctor. Welcome to the podcast, Dr. Rubin.
Thank you. I am so excited to be here. It was a long wait.
I'm glad that this day has come because just a few months ago, we were sitting at dinner and we didn't get to finish our conversation because there were so many DPC doctors all around us chatting about their lives and asking each other questions. And so I really am excited to highlight you and your story. So I want to start with going back into your history of being a doctor and the motivations that led you to choosing the practice that you have now. Back in 2021, you had viral exposure through Kevin MD as well as through your blog because you had posted about your experience in your life before DPC. Can you share with the audience what you wrote about then that really touched so many people after they heard your words?
Yeah, I actually wrote that as I was getting ready to quit my job. I was still working and nobody knew, my colleagues knew, but nobody higher up knew that I was leaving. And I was a little nervous about having it be out there, but I just sat down one day after just having this horrible day in clinic and wrote it in probably 5 minutes or something, because I felt like I could not practice medicine in a way that was in any way serving others. And it was not, certainly wasn't making me feel like a good doctor. So med student had asked me, why do they book your well checks for 15 minutes? Kind of offhand, that's interesting that they book your well checks for 15 minutes. And I said, everybody gets 15 minutes for everything. And they were shocked because it doesn't make sense. But I think we are so brainwashed in medicine to think that the way medicine is the only way and is the right way. And at this point, I was realizing that it's not, and there is another way.
And something else that you wrote in that blog that really hit home, especially as I shared before we started recording, my husband's position was recently eliminated because the clinic that I worked at and that he is working at as of the day of this recording, his position is being eliminated because the clinic is going towards a non-physician model, which is legal in the state of California, as well as many other states in the nation. And the part that hit home even more for me after getting that gut punch of you sharing about the 15-minute visit with the innocent med student who is naively going into medicine, yes, not knowing the things that we didn't know about medicine, yes, was that you wrote, I'm the only pediatrician who gives my teens 30-minute well checks, and I take a pay hit for this. So can you tell us about that financial part that you mentioned specifically? Because you worked over a decade where you were dedicating your life to the kids that you served. And for you to be taking a pay hit for someone who's worked over a decade in their position, doing a fantastic job, how did that portion play a role in your sense of devaluement from the system?
I was paid completely based on RVUs. So the more patients I saw and the more I billed, the more I got paid. And if I changed anything about my schedule from the 15-minute visits, I was going to be seeing fewer patients. And it didn't matter. That was the right thing to do. But there was no way around that. There's no way that you could get compensated for being a better doctor or doing all of the things, taking care of all the things that your patient actually needed. And in fact, to top it all off, it's like the things that we actually do get bonuses on or whatever are things that are so irrelevant and just check boxes that we're checking off that really have nothing to do with the good care of our patients. And yeah, it just didn't feel good. I did that with newborns too. And because of that, I ended up seeing fewer newborns because it was harder to get them in with me because everybody else had 15-minute appointments and it was harder to find those 30-minute slots. But that didn't make sense either. And it just really feels lousy to not be able to get people to see what's going on. And it's one of the big things that I'm still seeing in DPC because there's definitely a lot of education that needs to happen for people to see what DPC really is and where the value is. And yes, there's a reason why you might actually pay your doctor. People are so used to not seeing the money in healthcare. It has been really taken out of the equation. The money for your insurance comes out of your paycheck, so you never see it. And then you walk into your doctor's office to have an appointment. You have no idea how much it's going to cost when you walk in. You maybe have to pay your copay when you get there, but you have no idea how much the final bill is going to be. but you go because that's just the way it works. And if and when you do get that bill later on, half the time you might not even remember why you were at the doctor, let alone like might have made sense to get these charges, and you just pay it. And it's this system that has just been perpetuated and perpetuated so that when I am not taking insurance and I ask to be directly paid, people just absolutely have no idea what to do. There's no concept of it. And it doesn't feel good to me too. Like, I don't like asking for money for something that I'm doing because I want to be doing it. I'm not doing it for the money, but I still have to make a living. And it's a really hard hump to get past for people.
So on that note, I want to ask, because this is something that was pretty heavily discussed while I was at the Peds Mastermind that was in Orlando that you spoke at, when we talk about how we don't even know what we're getting into necessarily after medical school training. We go into residency and we are just told this is the magic way that you get paid. You do your bills, you do your patient visits. This is how much time you are given. You get your codes and then you go into the next patient. The academies that we have signed on with, American Academy of Family Practice, American Academy of Pediatrics, all of the academies that no matter what type of physician, if you're part of, the fee-for-service system is what is most prevalent in those systems. So when I think about the Mastermind and the American Academy of Pediatrics, and the most common type of visit in pediatric clinics is going to be fee-for-service. Recently, they released an update about obesity and pediatrics. And one of the things they talked about in their opening section was inequities in healthcare. And that was where the argument was really getting hot and heavy at the Peds DPC Mastermind, because there was a large argument, and a very valid one, that DPC can remove those inequities because of access to quality healthcare for everyday Americans. This is a loaded question, but what is your opinion when it comes to, does DPC remove inequities when it comes to kids all over, no matter what background they're coming from, getting quality care, so it makes a huge impact in their health going into the future?
I think it does. I think about all the guidelines that get put out about everything. How in the world are you supposed to do all of that in 15 minutes? No way can you do all of that in 15 minutes. And actually, I'm on the co-chair of the Illinois AE chapter, and I'm co-chair of their breastfeeding committee, and went to one of their meetings. And this was exactly what coming up. Like, how can we do better by our children? And the big barrier that kept coming up was time. We do not have time in our clinics to do all of these things. And the obesity issue was one of the ones that we were talking about. Those inequities are absolutely seen in the fact that I think people who are disadvantaged, sometimes they don't have a medical home at all. And they may just get their shots on some mobile van and their school physical by who knows who. And that's the one time that they get seen every few years. And none of these other things that are truly important, whether or not, I'm not going to say whether or not I think that the obesity guidelines were on target or not. But if you want us to talk about all of these things, you have to give us more time.
I think about it, like, even as a doctor, as a family practice doctor who takes care of kids, when I had my first kid, I was like, you can't discharge us because I actually don't know what to do with this baby. Like, you've been taking, this is pre-pandemic. I had my first in 2017, but it was like, you took the baby to the nursery and then we would feed the baby and then you would take the baby back. So I don't actually know what to do when you give me this baby. Like, I don't know what to do. And as a physician, I'm thinking that how much more someone who might be like, the youngest person I delivered was 13 years old. How can you expect anyone in 15 minutes. English is not their first language. They have other children in the room that they can't pay attention to you. All of the situations where 110% agree with you that we cannot do our jobs without having time with each patient that they deserve. And that time will change. Sometimes you don't need as much time, but other times you need a ton of time. So I'm so glad that you are at the level you are in your state chapter of the American Academy of Pediatrics. And I'm glad that there are other people in the DPC community who are speaking out at the state and national levels when it comes to our patients deserve better and we deserve better as physicians.
And that's one thing that people actually complain about with the Academy of Pediatrics in particular. I don't know exactly how all the other academies are, but they advocate for the patients, they think, but don't advocate for the physicians who are stuck in this mess, trying to do everything and needing to do everything and wanting to do everything, but not being given an appropriate arena in which to do that. And I do think that DPC can bypass many of those barriers because people also think of DPC as concierge, and it's not concierge. And I hesitate to use that term even to get people to understand the model a little bit because people think about that and think it's just for the wealthy. And it's not. This is affordable care. It is on top of your insurance if you have insurance. It is. But it may allow you to take a less expensive insurance because insurance is for the big things. Insurance was not originally supposed to be something that paid for everything. Like your car insurance does not pay for your oil changes.
Yeah. And it's so interesting you say that because recently I've been thinking about if I had my druthers, I wish that people in high school would have economics, that they would have home ec. And when I say economics, like everyday economics, like this is how much money it costs to have a child. This is how to budget your finances so you save it for your retirement, that type of stuff, rather than Adam Smith and the history of economics. But one of the things I've been thinking about recently is it would be helpful for people to learn to create a cultural change earlier on, how to play in the healthcare system. And hopefully this healthcare system doesn't continue to burn like it is right now as we are rising above the ashes to take better care of our patients and ourselves. But when it comes to how to use your healthcare dollars, just like you pointed out, it's insanely important for people to understand, look, you could have paid Dr. Rubin this amount of money. And because you've paid her this amount of money, your child was kept out of the ER for croup, for a rash, for whatever. And each time a child goes to the ER, how many hours are spent in the ER? How many thousands of dollars are racked up? Especially if a person has insurance, the insurance only covers so much. And then magically it's on your dime. That's why so many people are going bankrupt in this country. So like you said, we don't see the money. We need to see the money for sure. And DPC definitely is helping people bridge that inequity of not understanding our healthcare dollars and spending. Stay with us. We'll be right back. Thank you to Spruce Health for supporting the My DPC Story podcast. The ways we communicate have changed dramatically over the past decades, but technology and tools in healthcare have not kept pace. Patients want more access and digital convenience, as well as the ability to text their care teams. Care teams are inundated with more communication and rising expectations, but are still using tools and technology stuck in prior decades. Spruce Health created a solution for the tech-forward DPC practice by creating a communication product designed to serve both the patient and the doctor through intuitive HIPAA-compliant workflows, tagging, scheduled messages, and triage templates ready for use, whether you're on your phone or in the exam room. New users get 20% off for the first 12 months of a paid plan with code MARYAL20. That's MARYAL20. So check out Spruce Health today at sprucehealth.com or check out the link in the show notes.
And I think it is very important to be transparent. I have my prices on my site. Now, I know that, yes, some people are going to look at my site and say, I can't afford this, and I want this, but I can't afford this. And I'm still relatively new But I think most DPC docs feel that it is very important to be able to take care of people who maybe still can't afford what affordable fee we are charging, and we'll figure out a way to do it. And I do already do that. I would like to be able to do that more as I grow. So we actually have the time that is necessary to put into all of that, to put into figuring out how we can take care of everyone who seeks us out, and just have the time to do everything that's needed. It just keeps coming back to that. I just remember what it felt like to be in that room. And I think I can't remember if the quote that you said, if this was included, but I was always running late. And my MA, who I loved and was like trying to keep me on track, out of the goodness of her heart, she was going to make me get out of the room on time. And she was going to knock and make me stop no matter what I was doing to get out of the room. And I was like, forget it. I'm not leaving the room if I haven't finished what I need to finish. I'm sorry, I can't do that. And it's just infuriating. You can see I just get so mad thinking about it. And I get mad now, like I got out of that system, but I still feel like I'm stuck in that system because everybody else is stuck in that system.
So as you have shared what was going on before you opened In Touch, I want to ask about how you came to learn about DPC.
So I was actually at a breastfeeding conference, and there were a couple of people at the conference who were planning to start DPCs, and I had never heard of it. And I remember just thinking, oh, whatever, like, that's not for me. I'm never going to do something like that. What in the world? And these people kept repeating that message into my ear in various places along the line after that. And it just started to make more and more sense. I learned more about it. The Facebook groups have been just phenomenal at helping people to understand what it really is and how to have a practice like this. And as I was trying to navigate my way out of my other job, I was really struggling for years before this to figure out what I could do that would be any better. I just felt like everything I looked at was going to be just more of the same, just in a different place. And DPC was the one thing that offered me something completely different. And it scared the what out of me. And it still does, because I never wanted to be a business owner either. And I loved the fact that I had nothing to do with the finances. But in the end, that just doesn't make sense. It doesn't allow you to do what you want and need to do as a physician, or no matter what you're involved in. To be able to make those decisions yourself is so important and so empowering, and it is so freeing.
As you talk about this empowerment and this freedom that you experienced, even though you had hesitancies about taking money from people, selling yourself in terms of selling your services to achieve your freedom, how did you overcome those fears or those hesitancies when you were getting started?
Yeah, I'm still working on it. It's a work in progress. I think as my fury gets louder and louder, like I just realized that this is the way to do it. And there's no reason why I shouldn't be paid directly for my services. In anything else, that's the way it works. And I think I've just come to accept that I am also now a business person, and my family depends on me, and I have to allow myself to take that role and to be the business person, but still, like, I'm not in it to make $1 million. And that's the difference between us and those administrators who, yes, are also, they're the ones about the money, but they don't even see the patients. They're so far removed. And I think it just takes time and doing it, and then seeing the results, seeing the effect that you have, and seeing the relationships that you're able to develop with the patients that are so different and feel much more rich and meaningful to me now than they did in the old system.
I love that. It's such a common thread that we're not burned out by our patients. Yes, there are some people they work our patients beyond belief. But in terms of overall, when we talk about what was our last straw, when everyone has shared on this podcast, like what led them to practice under the DPC model, it's not the patients, it's always the other things. So when you talk about opening your business and having a chance to even be a better doctor with your patients, you have an even deeper relationship, how you have become not only a pediatrician, but also a breastfeeding specialist. You have two of your own, but you are an IBCLC, so an official lactation consultant who is also a physician, which is flippin' amazing because you cannot replace the importance of how that medical knowledge really supports what we know and get and answer questions on when it comes to breastfeeding. So how did you decide to incorporate IBCLC into your services and your journey as a physician?
It was interesting because I decided long before I left my job to become more knowledgeable and able to care for my breastfeeding patients. And that just made things worse at my job in terms of not having enough time. So it led me to where I ended up. But as many people who go into lactation professionally, we had problems with our own kids or problems with our own breastfeeding journeys with our kids. And I did. And I wanted just to be able to better serve people. And I just want to clarify the difference between IBCLC and breastfeeding medicine, actually. So I didn't know this at first either, but there is something that is called breastfeeding and lactation medicine. And what this is, physician level care of breastfeeding problems that may be more complicated than can be handled by an IBCLC. It's just simply out of their scope of practice. They may even have an idea of what's going on and know about it, but they can't practice medicine. An IBCLC is a counselor and an educator, and that's where they have to stop. And as a physician, I have training that is geared specifically towards physicians and how to work up, diagnose, and manage more complicated problems. So this is something that most people don't even know exists. Most people being IBCLCs and other doctors and patients. And unfortunately, there's so much mismanagement out there of breastfeeding issues because it has not been prioritized. Women's health in general has not been prioritized in this country. So people who have these issues end up going to the only doctors they can to deal with these things. Usually they're OB, maybe they're pediatrician, maybe a breast surgeon. And those people, unless they sought it out themselves separately, they did not receive training on it. So they're flying by the seat of their pants. They want to be able to help, but they don't have the training. And so then things get mismanaged, and that leads people to stop breastfeeding. Essentially, in the end, they either are miserable and have mental health problems because of it, or they stop. And now that there are more physicians being trained in breastfeeding medicine, we are able to help solve those problems and hopefully nip them in the bud and prevent them from getting mismanaged. I actually just had a patient that I saw for a prenatal visit who had a disastrous experience with her first baby and wanted to try to prevent it the second time around. And she had some complications, and it's hard to know for sure that that there won't be any problems this time. But I said, I cannot promise you that is not going to happen at all. But what I can promise you is that it will not be mismanaged this time. So it will not turn into that big disaster that it turned into last time. You will have people, you have sought out the right people to be able to support you, and we will make sure that you are okay and you can lactate healthfully and hopefully much more successfully than last time. And it felt really good to be able to say that. And I don't know that I was doing some breastfeeding medicine in my old job, but now I can, again, do it the way that I need to with much longer appointments and spend a lot more time getting the word out. I'm focusing, because I am a business person now, on advertising this breastfeeding medicine service. And I think that if I had stayed where I was, I would have just been in this little place doing it, but I certainly wouldn't have had the time to really be advertising about it and getting the word out that it exists. So hopefully this will start in the Chicagoland area. There will be more and more of an ability to help these people, because people will know that the services exist. And there's me, there are other people practicing this as well in the Chicago area.
I love it. And while we're talking about breastfeeding medicine in physicians involved in breastfeeding medicine, I know you had mentioned some resources at the Peds Mastermind. So can you mention some for the listeners that I'll also put in your blog?
Absolutely. First of all, I have a YouTube channel where I try to put out some good information. But for other physicians in particular who are looking for, maybe thinking about getting an IBCLC or thinking about learning more about lactation, there are resources out there that are geared specifically towards physician education. We are in the process of creating a certification for breastfeeding and lactation medicine. So you may want to look into that more and not get your IBCLC, because there's nothing wrong with getting your IBCLC. But if you really want to be able to manage more complicated problems and make this a focus of your practice, then physician level training makes more sense. And so IABLE, which stands for the Institute for the Advancement of Breastfeeding and Lactation Education, is absolutely amazing. They have wonderful conferences and tons of information and resources on their website as well. And I think are going to be more and more other resources out there as more of us get the certification and get this training.
Fantastic. And I will definitely include your YouTube as well as IABLE and any other resources that you think of after our recording. I love the IABLE cases that they'll drop in your box.
Yes.
It's a drip rather than a flood, because when having sat through conferences through IABLE, it is a lot. And you're just like, yes. My experience has been like, I didn't learn that in medical school. Wow. And I'm very grateful. I had a very positive breastfeeding experience with both of my boys, but having attended those conferences, it gave me answers that I didn't have prepared with me when I was counseling other moms who were having breastfeeding issues. So I definitely support IABLE as a fantastic resource. So thank you so much for that. And definitely check out Dr. Rubin's accompanying blog with this podcast.
Another one that I just want to throw out there, though, is PSI, which is, it's Postpartum Support International, I believe. It is an amazing mental health resource for perinatal mood and anxiety disorders that are so prevalent. And it's really important for physicians and families to know that this is a resource out there. So that's something to just have in your toolbox.
So as you have talked about the experience that you had before DPC, and you've talked about how you've had a mind shift going into owning your own business and operating your own business, I want to ask about your business model first. When you opened In Touch Pediatrics and Lactation, you opened as similar to my opening, and this is what we talked about over dinner, as a virtual and home visit based model. Can you tell us about why you decided to open up your practice in that way? And have you thought about any other models, and what was the reason you ended up choosing the model you did?
Yeah.
Stay with us. We'll be right back. Have you tried an AI scribe in your clinic? Well, I've tried so many, and I can say Heidi Health is the best AI scribe I have come across thus far. With Heidi Health, I can create unlimited customizable templates for my notes to help me truly cut down on the time I'm spending charting. Template for pediatric well child check? Done. Template for weight loss management? Done. Some of my favorite things I've built into my AI template, beyond the general soap note, are having a list of actionables for our team to take after a patient visit, having the diagnoses listed, and creating an after-visit summary for our patients. Not only have I found Heidi Health to be the most helpful, customizable AI scribe so far, it's also more affordable than most out there. So try Heidi Health today and see how you can harness the power of an AI scribe for your practice. To get an entire month of Heidi Pro free, go to the homepage of mydpcstory.com and click on the Heidi Health ad.
Part of why I chose it was just being able to start out with low overhead. I think that's really important. I didn't have some big sum of money to to support me, so I didn't have to worry about rent, which is wonderful. So I figured that would be a good way to get my feet wet. And breastfeeding medicine and pediatrics and taking care of babies after they have children, it just lends itself, I think, to home visits. And it's funny that the only home visits that are really paid for in the fee-for-service model are geriatrics, but they're not the only ones that need this. So it just was a kind of a natural decision, I think, because of the breastfeeding. It's just so much easier to figure out how to help somebody when you're in their space and you see, both with breastfeeding as well as pediatrics, like, what do they even have blocks? If I'm asking if their kid can stack a tower of blocks, do they even have blocks? I can see where a child sleeps. I can see the chaos or the lack of chaos in the house. And some chaos is good, actually. And it can make a big difference on what I can help them with. And I'm not claiming to be perfect in my own home in any way. I have my own issues, but it just really helps you to take better care of the entire picture, essentially. So I really enjoy that aspect of home visits. And kids they just tend to be more comfortable in their own environment. And so I can really observe their development so much more naturally. I don't even have to ask my developmental questions. Like, I feel like in the office, I really did, because usually the kid is like just sitting on their parents' lap and they're scared of you, and you don't really get to see what they are truly like if they're in those much younger years. And at home, you can see everything. And I really love that. I also offer fourth trimester packages, and this has evolved over time, but I think that I have found the package that works, which is a 6-week package where I am the pediatrician and the lactation support person and just the overall like cheerleader for this family as they transition to having this new baby, whether it's their first, second, sixth, doesn't matter. And it's interesting that I've had more people sign up for this package who it wasn't their first baby, because people don't realize how hard it's going to be until they've done it. But it feels so good to just, on these rainy days and snowy days, I'm the one who comes out into their house. They don't have to lug the baby and the toddler and everybody out. And I think helps that transition so much. And I have loved doing this. Now, that being said, I really do love all of the home visits, but it does limit my ability to see more patients, which I don't want to be seeing 15-minute appointments, but I do feel like the time it is taking me to do the driving, it's a lot. And I'm not really getting reimbursed for my driving time, and it's just wearing on me a little bit. So I do think that I probably will get some sort of brick and mortar, something or another, over sometime in the next year or so. So maybe at around the 2-year mark. And I don't know what that'll exactly look like, but I think it will help me to especially see more of the breastfeeding. And I think I will still have the fourth trimester packages and still see newborns and whatever breastfeeding I can in person. But I think that it will help me to just be able to have a better work-life balance too, which is what I was looking for originally as well. And to not have to do that driving.
And I love that because as you pointed out, like you were thinking about how to get out of your job years before you actually made the leap into your own practice. But that took years, and you've been in practice for less than 5 years so far. And you're just like, yeah, I'm going to change my 4th trimester package. I'm going to do this because it works for me. And I love that. I think about how Dr. Tom White reflected that he was so grateful that he's doing DPC. And if he had learned about DPC earlier, before his 60s, he would have done DPC, but he didn't know about it. So I think that I am so grateful for yourself, for myself, for all of these physicians who are finding DPC earlier on in their careers, because we have more years ahead of us to then change and adapt to our communities the way that our communities need us to. So I absolutely love that you are thinking out loud about this and thinking about it's not all sunshine, lollipops, and rainbows. When we were at dinner, like I totally empathized with you. For me, and I'm going to ask you about what your tools are, especially because I recently asked Dr. Rosana Lastra an update about her tools because she went from exclusively home visits to having a clinic space also. But I would forget things left and right. And I had to create my systems and get it. But absolutely, like when I go into a home visit, it's typically 2 hours long. And so when I see somebody for 2 hours, and I could have seen more than one patient in that time with a clinical space, I absolutely hear you. But I also think that's super genius when it comes to you're wanting to open. You don't need a clinical space. You have your person, you have your training, you have your brain, you have your tools that you need, and you have gas. You can go do those things that you need to do without the high overhead to start. So I love that you are morphing and you are adapting, and this is how you continue to own your business. So I'm like, go, Dr. Rubin. Yeah, love it.
And the other thing is that the DPC community is so supportive. I don't know how much of my pivoting and everything is just from my own ideas. It's like hearing what other people are doing and hearing what works and what doesn't work and what other options are out there. And even just locally within this area, the other DPC docs are all like, we all just want to help each other survive, because the more of us survive, the more we can change medicine. And the more each of us survives, the more each of the rest of us will survive. And I think we know that. And it's so refreshing to be in that sort of community where everybody wants to help everybody else. And just this podcast is so amazingly helpful to just get the word out, but also talk some specifics about what has worked and what hasn't worked so that can help people down the line.
Absolutely. And for years to come, that's what I love, is that you could pick up your story 5 years later, 10 years later, and somebody can still be learning from your experience.
Yes.
So that said, on the topic of tools, because you are doing breastfeeding medicine, your 4th trimester package, you do ear piercing, you do general pediatrics, what are your tools that you are typically carrying when it comes to home visits?
So I have a scale. I think that's very important. I have a baby scale and I have a bigger scale. And I finally found, it took me a while to find ones that I liked for that too. I use a big, bulky backpack for the majority of my tools. And I have one little baggie that has all of my like thalamuscope and my otoscope and my head circumference tapes and my HENT bag, which is head, eyes, ears, nose, and throat for people who are not medical bag. And then I've got my blood pressure stuff, and I've got all my blood pressure cuffs, because you just never know what you're going to need. And I think the big thing that is probably different about being home visit pediatrics is also I've got my little cooler for my vaccines, and isn't simple. I feel like I finally have it down. You need to be able to have the vaccines at a very specific temperature, not only when you're storing it in your office or wherever these are just being locally stored, but on your way to a bunch of visits, they need to stay that temperature. And so I have my little thermometer, and I always forget to turn my thermometer off when I get home. And my family's, what's that beeping? What is that? I'm like, oh, it's just the thermometer is telling me that the temperature isn't right, but that's okay because there's no vaccines in there anymore. But it's really fun, actually. This is the stuff that I didn't do. I never gave vaccines. So I've had to learn all about this, and like, where do you even stick the needle? And it's fun. It's like having a whole new career, actually, to be able to learn about these things and do these things. So that's my vaccine stuff. My vaccine bag has all my different size needles and my little Buzzy Bee. So my Buzzy Bee, this is something that just helps with pain control. And I learned from another DPC person to have some essential oils for distraction too, which I think is great with vaccines, and bubbles. So I always give these little things of bubbles because they're great distractors. It's a good toy to just be able to give the kid as their little visit gift instead of a sticker or a lollipop. So I give the bubbles, but I can use them to distract a kid while I'm doing vaccines, or an older kid can actually blow the bubbles themselves because that makes them take deep breaths in and deep breaths out. And that's exactly how people can calm themselves down when they're nervous about getting shots or some other procedure. So I use it for my ear piercing too, because despite wanting to get your ears pierced, many people are nervous when the moment actually arrives. So I think my bubbles are big. I actually had gone to the dollar store and bought a bunch of random toys initially. And then when I got these bubbles, I was like, no, this is just going to be my thing. It's perfect.
I love it. I bet you a bunch of people are opening their Amazon app to buy bulk bubbles, which is awesome.
I should send you the link to the bubbles I have, because they're just a cheapo giveaway, and they are the best bubbles ever. They're teeny little bubbles because it's just this teeny little thing, but they are really good bubbles. Yeah.
And there is a difference between good bubbles and bubbles that don't actually become bubbles. I love that. I do this because I love shopping on Black Friday, but I have a notepad note in my iPhone where I keep a list of things and links that I want to buy on Black Friday. And I have the one that Dr. Nazia Sharif had mentioned in her podcast, but I also have the stadiometer that is like a triangle that's wireless.
Yes, and I have that too.
Yeah.
Yes.
And that was on Black Friday sale. So if you have links of things that are a little bit pricey and you're wanting to get them and you don't need them today, definitely something to think about putting them in a list for getting ready for Black Friday. And then also, if you just put them in your Amazon cart and then save for later, sometimes you'll get alerts that, oh, the price has gone down by 10% or whatever. So just little tips there, but I cannot wait to buy these bubbles that you speak of.
Really good. The other thing that you don't realize that you're going to need, I think, is a script pad. We do electronic prescribing most of the time now. And for some things, at least in Illinois, we have to electronically prescribe. But how do you write an order for labs if somebody's going to just go to a lab? Really, you have to write it on a script pad, and for a referral or something like that. So it's probably that old school thing that is still alive because it has to be used in certain situations. Like doctors still use pagers. It's totally outdated, but yeah, doctors still have it. And faxes. Oh my gosh, my husband, when I was trying to figure out the fax situation, and my husband's, what in the world do you need a fax for?
100%. Oh my gosh. And
I have no concept of the fact that the rest of the world doesn't fax. Yes, doctors still fax. They also send things electronically, but it always gets sent as fax too.
In my area, because we live in the forest, literally, when there's no electricity and there's no electronic prescribing whatsoever, there's no phones whatsoever. That is another case scenario where doing home visits where you're prepared with paper to write a script on is definitely a use case that not too many people think about when they're doing a home visit or an office visit until they lose electricity. Or we saw nowadays that can happen in any community and it doesn't have to be rural. I appreciate you dropping those nuggets of gold when it comes to labs and when it comes to referrals. And those are things that can be faxed. So I love that. So when it comes to You spoke about how there are other breastfeeding medicine physicians in your area, as well as other DPC physicians. Dr. Claudia Ryan, Dr. Leah Gupta are two that come to mind. They were at the dinner with us. When you look at your practice and when you went from opening as a telemedicine and home visit model with low overhead, how did you market your practice and what did you find was the most helpful getting patients to join in at your practice?
I think I'm just starting to figure that out, actually. And I do think that local moms groups, like moms just talk, they talk and they ask, who do you recommend for this, that, and the other thing? And I was a little bit squeamish about advertising myself in those kinds of groups. At first, it just felt weird, but once I started doing it, I got some really great responses, and especially the breastfeeding and the fourth trimester stuff. I think that's really helpful to advertise that way. And then just getting the word out to other people who work with your people, right? So other doulas and midwives and people who take care of adults, those adults have children. And so this is also my new career, is figuring out how to market and network and all of that. And it's definitely my least favorite part of this. It's way out of my comfort zone, but people aren't going to come to you if they don't know that you exist. So you have to get yourself out there.
And like you said, your fury of you cannot ever go back to that system is driving all of the things that you do so that you can continue to be the awesome pediatrician that you are.
Yeah.
So when it comes to talking with people who are adult medicine physicians, whether they're OB or family medicine, when it comes to doulas, how do you approach them? Do you cold call them? Do you have a packet ready? How do you approach other people in the medical community?
So I think what I have learned is whatever you do, you have to do it again and again before people are really going to respond. It's that, I guess it takes 7 touches before people are going to start to respond to whatever it is you're doing. So I have tried everything, and I think certain things work for certain people. And if you have if you can get introduced to somebody by somebody, that's definitely the best way. Or if you have some sort of personal connection to something about that person. So do your research. So get on to their website. Oh, somebody just taught me this one, which I hadn't thought of, which is, if you are going to cold call or cold walk into an office, to look up on the website, what is the name of their front desk person? So when you walk in, you can say their name immediately and you will win them over. And that front desk person is the one that you want to win over, because that's the person who knows everything that's going on and is going to be asked, oh, I'm looking for a pediatrician. Who do you recommend? Now, I can't say that I'm perfect at doing this, but I think that these are really important to just be persistent, keep doing it. And eventually it will work no matter what way you are trying to get yourself out there. People just have to see you again and again.
I love that, and makes me think of how Dr. Leah Gupta was sharing at the DPC Summit last year, as well as on her podcast, how she would communicate with people through social media.
Yes.
And then say, hey, would you mind if I came by for a visit? And it didn't have to be another medical clinic or office. It would be anybody in general who could potentially be interested in DPC as a patient. So I think that it's ironic because you are a pediatrician who's purposefully choosing to build good relationships, quality relationships with people. That's how you're doing your marketing too. So I think that's really cool. And it really speaks to how this is really a relationship driven model. One of the things I want to ask when it comes to marketing and marketing yourself is you have some incredible pictures on your website. It's Dr. Rubin with this mom who's holding their baby and breastfeeding, or Dr. Rubin with the otoscope. And so how did you end up getting those pictures? And do you have any tips for other people who might want to get pictures similar to yours?
When was this? I guess this was probably when I was expecting my second baby. I saw a photo on a local moms group. I just saw somebody posted like their family photo or something, and it was very not staged. And I loved it. And we were getting ready to have family photos taken, and we were about to have a baby. And so I contacted the person who posted that and said, "Who's your photographer? I really love that photo." And she told me who she was, and I contacted her. And she became our family photographer. And so naturally, I asked her to be my business photographer as well, because she's just so good at just capturing the moment and very candid shots. And so she is going with me to some regular visits. But another thing, I don't feel super comfortable asking my patients. There are some that I feel more comfortable with because I just know in a different way, but I don't necessarily want my patients to feel obligated to say yes to me if I ask them if they would be models for me. So I actually put an ad out or a post in a mom's group about, if anybody's interested in being a model, I will trade you a breastfeeding consult. And I got the most amazing responses. First of all, just responses saying that they would willing to be models, but I didn't realize that this was actually in and of itself advertising my practice. And some people were like, "I'm looking for a pediatrician. Let me find out more about that." And so I found some people. And so my photographer went with me to those visits, and I've met some really amazing people that way. Yeah. So I think you have to find a photographer and just somebody that you like their style, and just take them and tell them what you're looking for on your website, what you need on your website, because you're going to need some vertical pictures and some horizontal pictures and some pictures of you and some pictures of just the babies or just the patients. And so we're still working on it. We're not done. We got waylaid a little bit in there. So we're still going out and taking more pictures. So there's more to come for that.
So one of the things I love about your website is specifically on your 4th trimester postpartum package page, as you're scrolling, which many a mom, I am definitely one of those people at 2:00 in the morning when I was feeding my kids, I would be scrolling. You will see on your website facts about your practice. Feel confident as you navigate getting to know this little new human and your new role in your family. And the way that you're scrolling, the words that are empowering to your patients or what they would like to be empowered with are appearing on your page. How you got your website. Do you design your website? Do you have someone design it for you? And how do you pull the copy that is relevant to your moms, your patients, your families?
I did my website myself. So I use Squarespace and in a weekend, and it has been tweaked since then, but I got the basics in the weekend. I like Squarespace, by the way, because you can put in your colors and it creates the scheme for you, which is really nice. And you can tweak that too. But I was comparing that with probably Wix, or I don't know what I was comparing it with, but it was better in that sense. And then the copy has definitely been tweaked over time. And the copy is also all just mine. And I sat there and I just wrote it. But those quotes, I learned through some marketing classes how to sell things. And when you sell things, you look for people's pain points and you look for the things that are going to be emotionally powerful to them, because that's what's going to get them to keep scrolling and ultimately to purchase something, to think, "Oh my God, I cannot live without this." And so I keep tweaking, but I guess it's nice to hear that I picked some good words.
When I think about avatars, I definitely think about myself in the position of fill in the blank. And so when I was reading your website, thinking about how, man, I watched all seasons of Criminal Minds when I was breastfeeding my first kid. And then when I was, I've already seen that episode and scrolling on my phone, all these terrible habits, I would get really emotional with random things because you're postpartum and you're not getting sleep is part of that. But when I read things like feel ready, feel empowered, have one less thing to worry about or to stress about, I sure as heck would emotionally react to and be drawn in by your website, especially envisioning myself as that mom at 2:00 in the morning. So again, congratulations. It's amazing. And you are showing up in your website, in your practice, and you couldn't do that with the time that you were limited to in your former practice. So it's beautiful what you've created.
Thank you. So, one thing I have to work on is SEO, because SEO is very important, and you should have SEO in mind as you are building your website. And I don't know that I did. I tried to do the things Squarespace told me to do, but I'm not ranking super high on Google. And so I need to work on my SEO. So that's just an important thing to remember when you're creating a website.
And if you're going through similar struggles, like how you said you took a marketing class to learn about copy and to learn about selling yourself, there are ways to learn about how to work SEO in your neck of the woods. It's so interesting when people take courses, when they've decided or when they're actively doing DPC, the way that courses information manifests is so different than if we were to do it in a different industry. So yes. I think it's so cool to see what people create. Yeah.
Yes. And also, like, my driving has not been for naught, because I'm pretty much always listening to some sort of business book while I'm driving.
So as you're talking about your practice, I want to ask about how you chose an EMR to support what you need supported in your practice, because you're offering home visits, you're offering a 6-week postpartum package, as well as things like ear piercings. So how did you go about selecting an EMR to support what you do?
So I actually just have my ear piercings separate from my EMR. So far I have kept it separate. I was thinking that I was going to combine it, but it just made more sense for me to keep it separate because it doesn't require the HIPAA compliance, and I just take the money in a different way. So that's one thing. But I chose one at first, like having no rent to pay. I chose one that was free to start out with, because I have learned that one thing that is not a good trait in a business person is being indecisive. And I'm about the most indecisive person in the world. So that does not fit my business person persona. But I knew I wasn't going to be able to decide right away. So I started with Charm, which is free, period. I can't even remember if there might be a top number of patients that you can have. I can't remember, but there are things you can add on and pay for. But I just said, I'm not super busy. I can do labs without having that integrated. I can do the billing without it being integrated. So I used that for a while and then started to get busier. I actually didn't mind Charm, but the thing about Charm is you cannot reach anybody to talk to about anything. So I knew that as things were going to get busier, I was going to need something with better customer support. And so I really debated, like, the PEDS people are looking for very specific things. We want to be able to easily print out a school physical form, and we want to be able to enter vaccines. And there's just very specific things that are not great in a lot of EMRs. And in the end, I actually just picked one because I really liked the people and I liked what they had to say. They were building from the ground up, but people who had already been with them seemed very happy. And it's kind of forcing me to be more simple in my notes than I usually am. They don't have all the check boxes, right? So you can make your note whatever you want it to be because you're not at the mercy of the insurance companies anymore. And it doesn't have to have a 10-point review of systems. And so my notes don't have that. There's no review of systems being asked anywhere. So I really like that. And it also integrates the phone, like the texting and everything, into the EMR, which was important to me because I was using Spruce, but I wasn't integrating it with anything because I hadn't decided what I was going to use. And it only integrates with one, maybe two EMRs. that I wasn't going to go with those EMRs, but I really like being able to text and know that it is going to go right into the chart so that I don't have to then go and write a note about what I was just texting, because it just saves time. And so I think that's something to look for sure in an EMR. And it's got its ups and downs, and there's a lot of changes coming with this EMR. And so we'll see. We have no idea what big package is going to be coming out soon that will hopefully be like the Wonder EMR. So we shall see.
And when people are joining your practice, whether it's for pediatrics, whether it's for lactation, how does it work when a person is onboarded? What happens from their experience after they say yes?
So they get a link to my EMR where they put in their information. So just their basic name, address, all of that. And then they can, and it's difficult not to put in their payment information. I do not charge anything right off the bat because I sign up everybody that same way. And my breastfeeding medicine people get charged one thing for their visits. And then my general peds are getting charged an enrollment fee plus then their monthly fee. And so it's not standard what they need to be charged first. So once they put in their information, that comes to me and I know that they are requesting to be approved and I approve them. And then I can send them, then I can charge them if there's an enrollment fee, or I can wait to charge them if they're coming for a breastfeeding visit. And I can send them all of my consent forms at that point. And then once I get the consent forms back, then I start to put them in their monthly fee bracket or wherever they need to be. And then I set up an appointment. And I really like, even if I have a new patient, and they've already been born, I want to see them as soon as possible, because if they're going to call me and have a question about their kid, I want to have laid hands on that kid already. So I like to schedule. I can't always schedule it. Yeah, usually schedule it for the same day at all, but within a week. For sure. And for my own patients, like I do get calls from people who want just an acute visit, or I got one once from somebody who had been thinking about signing up with me for a while, but had a kid now who was sick and wanted to know if I could see them. And I was like going out of town the next day, and I was like driving all over the city seeing my own patients. And I was like, I'm sorry, I have to prioritize my own patients. I can't. But if you want to sign up for my practice, you're welcome to do that. And then you can be my priority next time. So I think it works pretty well. I think I still need to automate some things, and hopefully this new package will make it easier to do that.
Fantastic.
Yeah.
And when you have your patients join you, no matter how they're joining onto your practice, you have a newsletter that is an option for people who are members and people who are not members. In terms of the newsletter, how do you use that to keep engaged with your community, whether it be current patients or potential patients and people who are just wanting to know more about what you're doing?
To be honest, I've just been winging it with the newsletter. I kind of have a standard format there and try to put something of some value in it every week, whether it is just purely informational about this breastfeeding topic or this peds topic, or just some thoughts that I've been having, or a new blog post that I just put. I don't have very many blog posts up. That hasn't been a big thing for me. And so I have that section. And then if there's anything, like when I had flu shots available, I put that in my newsletter so people knew that was available and that we need to make appointments for that. And I ask for reviews. Reviews are a big way of finding more patients. People want to see that you have been vetted and people have been happy with your services. So I do try to get out there and ask for reviews in my newsletter as well as other ways. And I ask people to share my newsletter as well. So that's helpful. If somebody sees something that's of value and they know somebody who it could be of value for, then just the more people are spreading the word, the better. I don't know that I have mastered the way to use my newsletter, quite frankly. but I'm working on it. And I'm going to like an event tomorrow, a little resource fair. And so there I will hopefully be able to, I'm having a little raffle. And in order to get into the raffle, you have to give me your email address to be on my newsletter list. So that's how you have to get creative about getting just more people who are going to keep hearing about you so that they can get those 7 touches and finally decide to sign up with you.
Love it. In closing, I want to ask one last question, because as you've shared your story, it's super valuable, but you've also shared how we came from a system that did not value us. And so when you go in from a place where you're not really valued for your ability to take care of patients, which is what we all went to medical school for, to a place where you are your own boss, you're running your own clinic, you're taking care of your patients the way you wish to. How do you keep your head above water when it comes to making sure that you're always valuing yourself for what you are achieving every day?
That's a tough one, because that's always been a tough thing for me just in general. And I am pretty damn proud of myself that I took that leap. That was really scary. And I look back and I'm like, I can't believe I actually did that. And I'm not going back. This may or may not end up working out for me, but I'm not going back. And I think I have to remind myself of that when I'm feeling a little bit more stressed out and worried about my practice. I did really want to have a better work-life balance, and that's really hard with a new business, really hard. They say that having a new business is like having a newborn, and it's true. And my kids, I wanted to have more time with them, and I do. I have more flexibility to be there for school events and sports events and things like that. But I'm often like furiously trying to finish my minutes of work when they get home from school, and I can't necessarily always be there, or I have to go to networking things at night, and I do miss dinner and bedtime, which I really don't like doing, but I think I'm putting in my time now. This is an investment. Somebody was just saying this to me, that it is an investment in myself that I am doing this. And I've started to ask my kids to be part of my decisions, for them to understand more what this means to me. And I had this one night when I was like, I have to go to this thing. I have to go to this very high yield networking event. I have to go. And I really didn't want to go. I just was tired and just wanted to be at home that night. And I was driving with the kids somewhere. I said, guys, I know you're not going to be happy about the fact that I have to go to this thing, but it's really important. I have to go. And I just want you guys to understand that and to tell me whether you feel like it's okay for me to go or not. And if they said no, I was prepared to not go, because I really didn't want to go. I kind of was looking for an excuse not to go. But they said, Mommy, you can go. You can go. It's okay. In the end, I actually didn't go, because in the end, I realized that what I needed more was to just be with my family that night. So it was an interesting way of coming full circle and realizing myself what I needed, and not necessarily trying to get that answer from other people. But I guess my point is that I'm still trying to balance work and life and finding time for myself. A few weeks ago, I was so exhausted and I didn't have anything super pressing on my plate. And I spent the afternoon watching Top Gun, and it was lovely. Just like a movie from my childhood. And it was like comfort food, basically, watching Top Gun. And every now and then it's okay to do things like that, because we have to feed our soul. Or like I tell my breastfeeding moms this all the time, no drop of breast milk is worth your mental or physical health. I need to be telling myself that, because I'm not so good at it on my own. And I need to nurture that home part of me and my time with my kids and my husband and my family, the rest of my family and me. So I'm working on it.
And you have the time and space to do it. So thank you so much, Dr. Rubin, for joining us today.
Thank you so much for having me. It's been so fun. Like, I never thought I was going to be on My DPC years ago when I was listening to it. So it's pretty exciting. And like when I met you at that dinner, I felt like I got really nervous because I was meeting somebody famous.
Oh man, I can't wait to see you again in person and give you a big hug. Thank you again.
Yay. Absolutely. Thank you for having me. And thank you for what you do, because you're really helping to widen the movement.
Next week, look forward to hearing from Dr. Andy Burkowski of Relax Health in Ann Arbor, Michigan. If you've enjoyed the podcast and you haven't yet done so, subscribe today and share the episode with a physician you may know who needs to hear about DPC. Leave a 5-star review on Apple Podcasts and on Spotify now, as well, as it helps others to find all these DPC stories. Lastly, be sure to follow us on social media. If you're wanting to continue learning more about DPC in the meantime, check out dpcnews.com. Until next week, this is Marielle Concepcion.